And welcome back to Life Unrehearsed. Matt Del Vecchio here, specializing in home care and the senior living industry. Just love Nina Simone. As some of you may know, I write for the Suburban newspaper as their seniors and aging specialist. And in this past Wednesday's edition, I wrote a column about the trends in senior living and how the industry has started to rebound since the pandemic. You can check it out in the Suburban. In fact, seniors residences in general continue to be a hot topic, and I'm going to be dedicating a segment on next week's show on Life Unrehearsed to provide you with a summary of those findings in that article. And I'm going to be addressing both public residences and private residences and the state of RPAs, or what we know as Résidences Privées Parrainées. So I'm going to address that on next Sunday's show at the end of the show. Speaking of the Suburban Radio Hour, great new program on CJD. It's every Sunday at 7 p.m. The boys are doing a great job, and you could listen in for the latest happenings in Montreal. All right, medication overload. In today's fast-paced world, it's easy to find ourselves overwhelmed with prescriptions and over-the-counter remedies. And according to the Canadian Institute for Health Information, 3 out of 5 Canadians, 62%, over the age of 65 take at least 5 different prescription medications. And about 24%, 1 in 4 over the age of 65 take at least 10 different prescription medications. Incredible, really mind-boggling when you hear those numbers, but these are factual. But what happens when all these medications start to pile up, leading to confusion, side effects, and even more health issues? Today, we're talking about medication overload with clinical pharmacist Camille Gagnon. She's the assistant director of the Canadian Medication, Appropriateness and Deprescribing Network, which is an organization promoting safe and appropriate use of medications for all Canadians. Camille, welcome to Life Unrehearsed.
Thanks for having me, Matt.
Well, thank you for joining us. Boy, this topic is I hear it a lot in my world, Camille. And I'm so glad you taking some time here on a Sunday. Many, many listeners and our clients are talking about, is it too many prescribed medications? So first, let's get some definitions from you, Camille. What is considered medication overload? Can you define that for us?
Yeah, and I wouldn't be surprised if it's the first time a lot of your audience is hearing this term. I would say it's quite a new term, medication overload. If we're to define it in simple terms, someone may be in a situation of medication overload when they're taking a combination of medications. There are usually more than one that are being taken, as we've just heard. The statistics just speak for themselves. Mm-hmm. So a person is considered to be in medication overload when the combination of medications they take is causing them more harm. You've mentioned harm here would mean side effects of all sorts, including you've said the confusion, but we'll go into details with more examples. Causing more harm than benefit. So the actual reason they're taking medications is hopefully, to improve their quality of life, to improve or extend their lives. But actually, we're seeing that, unfortunately, it's not the case for a lot of people where the medication isn't actually benefiting them. So it's quite preoccupying.
Very interesting what you're saying, especially when there's multiple doctors prescribing medications. And so, Camille, can you give us some examples of some of the consequences of medication overload?
For sure. So we'll just start off by kind of giving examples of side effects, because I don't want to go right away into the more extreme cases, because, especially, at all ages, but when we survey older adults especially, it's not so much the duration of life that people will put forward first, but more the quality of their life. So we know that, medication overload can reduce the quality of life. For example, something as, that can seem quite, benign, but in fact is quite annoying, maybe issues with, memory and, memory lapses, having trouble concentrating during the day. So those can be effects of that can be an effect of medication overload. Other examples can include things like dry mouth, dry eyes, having constipation, diarrhea. All of that can have someone just say, I'm not feeling comfortable leaving my house with these issues, losing their urine, for example, because of medications. So that may not necessarily mean the person is going to end up in the hospital because of their medications, but they may feel like they may end up isolating themselves. They may end up feeling, oh, I'm not as comfortable in a conversation where a lot of people are talking because I have trouble concentrating, just things like that. So I'd say, that all leads to what we would measure as decreased quality of life. So that's huge. And then we have a whole bunch of other measures that are very, very preoccupying, looking at falls and fractures. So taking too many medications that interact can make us less stable on our feet. We can be more dizzy. We're not, kind of as focused on seeing all those the things we would have known in our house to, lift up to go around or things like that. And we can trip and end up having a fracture. And that's huge consequence on health and leading, in all the cases, of course, to hospitalizations and even loss of independence. I've mentioned loss, of memory and issue with cognition. But yeah, when we look at hospitalizations, which I'm going more and more into what we could see as severe consequences of medication overload, we estimate that in older adults, about 1 in 10 hospitalizations is caused by a side effect of a medication. So it's not rare. And that's quite significant if we think that this was a treatment that we gave this person thinking we're helping them.
Yeah, it's supposed to help and making it worse, and they're hospitalized. Unbelievable.
No, it's so sad. So this is an issue that's very important. So the person winds up in the hospital, winds up leaving their home, being hospitalized for God knows how long because of their medication, and that can then lead to loss of independence. So those hospitalizations, examples of serious side effects of medication can be, things like internal bleeding because of medications that are causing your blood to coagulate less, or medications that cause stroke or serious side effects like that. That it does exist as well. So I followed a gradation to start with quality of life all the way to very severe consequences that, yes, can lead to death. But today what we want is just to get a word out on, it's a spectrum, and we want everyone to be aware that this can be, looming, and we're just not aware that we're affected by medication overload.
Yeah. Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm talking to Camille Gagnon about medication overload. Now, Camille, who would you say is at highest risk of medication overload?
So I've touched upon that a couple of times, but really going to the point is, as we age, we become more sensitive to the side effects of medication. So older adults are at higher risk of suffering from medication overload and those consequences I've mentioned, although no one is, safe from it. There's also an important population subgroup in the overall population that's affected by medication overload, and it's women. Women are more sensitive to the side effect of medication for a variety of reasons. But it doesn't mean that men aren't affected once again, but we see more side effects being reported in women than in men. And I'd say that the last group I would like to highlight are people who suffer from multiple health conditions. So if you're already affected by a medical condition that makes you more vulnerable really to a bunch of, factors that can affect your organs. If you take a medication, your body may be less able to correct and make sure you're back to, the state of equilibrium where you're not affected by the medication as much. So an example of this would be, say you take a medication that lowers your blood pressure, but the dose is too high. Someone in overall general health, their receptors in their body and the fact that their body's working, these receptors are working well, their body may be able to correct and make sure that everything's still okay, so they'll kind of compensate. But someone with multiple health conditions where these receptors may not be working as well, where the body isn't able to respond, then they'll be at higher risk of, falling, for example, because of the fact that their blood pressure drops.
Talking with Camille Gagnon. She's the Assistant Director of the Canadian Medication Appropriateness and Deprescribing Network. We're talking about medication overload, talking very important issues that Camille's bringing up. You're listening to Life Unrehearsed. Matt Delvecchio here, and we're talking about medication overload. Are doctors prescribing too many meds? I have Camille Gagnon on the line. Camille is the Assistant Director of the Canadian Medication Appropriateness and Deprescribing Network. Camille brought up some very good points. It is happening out there. You're seeing that, obviously, in your world, Camille. So what are some of the common reasons for medication overload?
Yeah, there's many of them. And maybe one we could definitely start with are a phenomenon called prescribing cascades. I'm not sure if you've ever heard of a prescribing cascade, but the term is quite nice, an image of something we don't want to usually we don't want happening. Prescribing cascade happens when medication causes a side effect, and unfortunately, often that side effect isn't recognized as such. It's just seen as a new symptom. An example of that could be, for example, a medication that's taken for a high blood pressure that may be causing some swelling in your lower limbs, so in your legs. And, people go and see a new health provider, and ask about that swelling in their legs. But the fact that the medication, the high blood pressure medication is causing it isn't recognized. And then we give a new medication to treat the swelling. We give a diuretic to eliminate that liquid. So that's one example. There are multiple ones, but prescribing cascade, so not recognizing a side effect and then giving new meds, definitely one vector and gets the list of medication growing and growing. So be on the lookout for that is one message. Mm-hmm. So these side effects, they don't always appear right away, although a lot of them do when we start a medication. To be on the lookout for side effects, and if we do notice something changing, asking, is that a medication that could be causing this, is always a best practice. Then you've mentioned it before the break, seeing a lot of different prescribers, such as different specialists, is definitely a risk for medication overload, because it's hard for all those prescribers to know what the person's taking, as well as what the person's taking that may not be, prescribed. So being transparent about everything we're taking, with prescription, without a prescription, super important. And then the lack of communication. It may be tough for the different health centers we go to. We move from a hospital to a long-term care facility or back home and then to the pharmacy, and then there may be information missing there. But really, if I was going to, provide one reason that medication overload can be a challenge for health providers to address, and we've seen this in studies, is that a lot of them say, I'm concerned. If I ask my patient, well, maybe we could look at your list of meds and stop some of them. Would you be open? It's surprising, but a lot of health professionals are concerned that their patients may not be open to it, or maybe wondering why. Are you letting me are you letting me go? Is it? And it shouldn't be seen as that at all, actually. That's just good care. So as a patient, being welcoming of this approach of let's go through my meds, yes, and let's see what I may be able to stop or maybe reduce as a dose. So those are all a bunch of factors, but being open to having your meds reassessed and determining if some of them could be stopped or reduced is definitely a winning approach.
Yeah, I really like that idea, and it's a two-way street, right, Camille? There has to be openness from the family as well. Very often, I'm dealing with hospital discharges, and we need to find a senior living community, and we have to provide the pharma profile, the list of meds, and sometimes there's 12, 14, 15 different types of medications, and usually that's what we want to ask at that point in time. Now's the time to relook all those meds, and are you open? So who would you approach to have someone take a look at it? Is this your pharmacist? Is this your primary healthcare provider? What would you suggest to avoid medication overload?
Both are good answers, actually. The community, the pharmacist working in the community, the retail pharmacy, is an excellent point of contact to get that done. Similarly, the family physician who's the person that knows the patient the best in terms of all the health conditions that are present, and has usually good the contacts with the family. In the case you've described, are very good starters. In Quebec, we are fortunate to have in a lot of family medicine groups, there are pharmacists these days that work to help the family health team, the whole group, assess patients' medications and provide recommendations to improve and reduce medication overload. So if you're a patient of a family, or also in the long-term care, there are more and more, we're going to see pharmacists there. So, if you or a family member are in long-term care, there is definitely a pharmacist involved, but more and more we're going to see a pharmacist in the actual care centers reviewing medications as well. So both of the options you mentioned, as well as the ones I've added, are excellent starters to ask, do I or a family member still need all these medications?
Right. A great suggestion there. Listening to Life Unrehearsed, Matt Del Vecchio, and I'm talking to Camille Gagnon about medication overload. We're quickly running out of time, Camille. However, if you think you're experiencing medication overload, you might not even realize it. So what should I do if I suspect it?
Yeah, exactly. Is that sometimes it's not even noticed by the person or the family may be noticing some changes, but they may be thinking, you know what, it's normal aging. Well, don't think that. Actually, that is a big myth we need to debunk, and not assume that if someone's memory is declining, or they're looking weaker, more depressed, they're not eating as much, a bunch of different health issues are happening. We need to change our approach and really always think, could this be a medication? Because more than often, they can be involved, and we can, look at it and get a nice cleanup done. There's a lot we can do. So if we are, concerned, or if anyone really we know, if we are taking medication or someone we know is taking medication, these meds should be reassessed, especially if we get, taking more. There is no minimum, right? They need to be reassessed continually. But if someone or you are taking 5 or more medications, especially, they should be reassessed. And every time there's a change, new medication added, getting that reassessed regularly to make sure, we're not suffering from med overload without knowing.
Without even knowing it, exactly.
Yeah.
So good, very, very good. Now, Camille, I have to thank Ruth Pelletier, who you may know. She's from Seniors Action Quebec. I was not aware of your network, and so very, very quickly, and you are a part of the Canadian Medication Appropriateness and Deprescribing Network. Excellent network and website. Can you tell us quickly a little bit about it, and how can we learn a little more about it?
Yes, thanks to Ruth for their amazing work at Seniors Action Quebec too. Our network, what we do is really we're here to ensure that the medications you take you're actually benefiting from as a patient, and we're here to help you as a patient engage with a health professional in the best way possible to reach, to continuously have those medications reassessed. So we have a bunch of resources online. We're affiliated to both the Institut de Gériatrie de Montréal and the McGill University Health Center. All, free, good information developed by experts. You could visit deprescribingnetwork.ca, deprescribingnetwork.ca to access these resources. And really, what we're here is to, improve the way we use medications and reduce medication overload.
Deprescribingnetwork.ca. Camille, I want to thank you very much, and we're going to have you back on as this is always developing, and appreciate you taking a little time here on a Sunday.
My pleasure.
All right, that's Camille Gagnon, the Assistant Director of the Canadian Medication Appropriateness and Deprescribing Network. Thank you very much for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with home care and the senior living industry, it'd be my pleasure to help. You can find out more if you look up Lianas Senior Transition Support. That's Lianas, Lianas, Senior Transition Support.